Hi, everyone. Welcome to this week's Real Talk. The topic of this Real Talk is going to be the importance of genetic testing, especially as it relates to the journey that it can be for some, especially those with rare conditions, to the path of a diagnosis, which, of course, is also the path to treatment, therapy, management of a condition, and the symptoms. I'm really excited. We should be having uh, Lucas from Probably Genetic here joining us, the CEO of Probably Genetic, to talk a little bit about the work that they are doing in the space of genetic testing. And also, I think, talking a little bit about our recent partnership with them. So we're going to be trying to bring on Lucas here. I'm seeing if he is here. Just give it just a second. I'm hoping he'll be able to join here in just a second. All right. Seeing that there's someone watching here. Lucas, if that happens to be you, if you are wanting to make sure that you are joining by your phone, that would be fantastic. So we'll give just another second here. But I think it's really important to talk a little bit about the journey of a diagnosis. Oftentimes, we talk about caregiver supports, resources after a diagnosis, which is obviously a really, I think, important thing and really speaks to a majority of individuals. But a vast majority of rare diseases don't have a cure. And getting to the path of a diagnosis of a rare disease can take a lot of time. And so genetic testing is one of the important tools that can be key to getting to that diagnosis. And so we're going to be talking a little bit about what some of the barriers are, and also, I think talking about both financial barriers, which I think is very important and can't be overstated, but we'll also talk about some of the other barriers around just kind of the knowledge and awareness of genetic testing, knowing the ins and outs of it, how to get to it. Um, Also, talking about the psychological and emotional concerns that can go in. So, we'll give Lucas just another moment here. Hi,
Hi,
Lucas.
cool. I'm so sorry about
Oh,
that.
no problem. I'm so glad that you were able to join. So,
Yeah,
I was just doing a little bit of a setup here, talking a bit about why we should be talking about genetic testing, especially for those that are navigating a path to a diagnosis. And so I am so thrilled that you and Probably Genetic are going to be able to, I think, share some really, I think, important insights. So I'm just going to kick it over to you. Introduce yourself and share a little bit about the work that Probably Genetic does in the space.
yes, and thank you so much for having me on. My Facebook app kept crashing, which is why
Oh
it
no.
took a second to get on the live. But I'm glad it worked out, and I'm hugely grateful for the work that the Caregiver Action Network is doing. I think it's absolutely amazing, and I'm really grateful that Alexion is supporting the work that we can do with you now. Um, my name is Lucas. I'm the CEO and co-founder of Probably Genetic. Probably Genetic was founded in 2018. We founded the company because of the work that I did during my PhD. I got to work on the world's largest rare disease study, which is called the 100,000 Genomes Project. It's a really big program in the UK, and the goal was, let's sequence 100,000 people and help them figure out which specific rare diseases they have. And the biggest learning that I had from doing that PhD on that program was that the 100,000 people who made it into that program were the lucky ones, because most people on the planet who have rare diseases don't have an amazing physician who can recruit them into a really well-funded government study, but instead they're super sick and they remain undiagnosed. And at the time we were trying to figure out, we have genetic testing technology, how is it possible that patients don't get access to the tests? And one key answer that stood out was that we just don't have enough physicians who are trained to recognize potential rare diseases when a patient's sitting right in front of them. And that's not on the doctors, it's just really difficult because these diseases are really complex. We founded this company to solve that problem. Our mission is to diagnose 200 million rare disease patients. We think there is about 400 million people on the planet that are sick with rare diseases right now, and at least half of them don't know what they have. They just know that they're not doing well, and most of them are doing worse over time. So yeah, that's where it came from.
Yeah, and I was just sharing a little bit before you joined that it's, the path to a diagnosis is, the path to treating and managing a
Yeah,
condition. We do know that a vast majority of rare diseases don't have a cure.
yeah,
It's really about kind of a treatment and management regime to help kind of keep symptoms manageable. So, um, yeah, I think that the work that you've done, both in terms of that research piece, to kind of speak to that need, but also now taking those findings and saying, let's do something about it,
yeah,
is so, so powerful. So I think, we can lay out the foundation of why genetic testing is important, but we know that there are barriers.
yeah,
And so, what are some of the barriers to genetic testing that make this tool inaccessible for so many?
yeah. Um, I think the clue is sort of in your organization's name. The key to this, I think, in many cases, are caregivers, because, as I mentioned, one of the biggest barriers is we just don't have sufficient numbers of really trained physicians who know how to recognize these diseases. And so the biggest barrier is you need a doctor to recognize, hey, something's going on here, and I don't think this kid has seizures and autism and heart disease all at the same time, and it's all unrelated. I think this is a genetic disease. We need to get this kid tested. Very few physicians have that insight. But as a caregiver, any parent knows when they're looking at their kid, especially if they have multiple kids, they can tell my other kid was able to sit up by this point, and my other kid did not look like this when they were trying to chase the ball. And the thing that other people might think is my kid not being focused on me talking might actually be a seizure. I'm concerned. And so the key barrier that we try to remove is when caregivers have this insight, they typically have to go to a doctor and then lobby the doctor and tell them, don't dismiss my concerns. We shouldn't wait for my kid to grow out of this. I think something's seriously wrong. And so caregivers turn online and they start Googling symptoms and they join support groups on Facebook and other places to try to figure out what the hell is going on.
Yeah.
The area that we try to remove is with the service we've built, caregivers can just go to our website and they can complete an intake form that asks about the patient's symptoms. And then we run millions and millions of dollars in free testing programs every single year and give out free testing where a test kit just arrives at your house. You collect a saliva sample or a buccal swab, a cheek swab. You send it back to the lab and you get the results. So yeah, I think that getting caregivers empowered is one of the biggest ways to remove barriers.
I really love that point because we often talk about the role that caregivers play in advocating for their loved one in that setting with physicians. And so, maybe it is being able to say, oh, well, I'm noticing that, this child, my youngest child, is not hitting the same milestones as my other child or is having these
Yeah,
complications. Or could it also be, both of these two children have had similar struggles, and so maybe there is something that we can start to peel back
Yeah,
and get answers.
yeah. And I want to make two additions. One of them is we have a pretty broad definition of caregivers,
Yeah.
because I think often when people hear genetic diseases, they think pediatric
y-
diseases, and that's
Right.
definitely true. But patients who are born with these genetic diseases typically don't grow out of those diseases, and at some point, those kids become adults and they still need help. So it can be parents of adult children, and we also work on the like far other end of the age spectrum because we work on diseases like early onset dementia, many of which cases are genetic diseases. And so all of a sudden the caregivers are the children or spouses of the patients. Yeah, and that's addition one, like how do we define what a caregiver is? And then the other addition that I wanted to make is you're 100% correct that most of these diseases, 95% of them, do not have treatments today. But the message that I try to give people is the future is bright because where there isn't a treatment today, there might very well be a treatment tomorrow because so much research is being done. Just a couple months ago, we diagnosed two siblings, to your point, two twins with an ultra rare, very specific genetic epilepsy. And that drug, there's a drug now that treats this disease that got approved last year. So 2 years ago, no treatment, and last year, all of a sudden, the treatment got approved. So there's hope.
Oh, and I yes, absolutely. I think that, the advancements that are made in medicine and the science around health is moving so quickly, and knowledge is power. And so when we put together the data that we're collecting from the research that you've done, as well as information that we are empowering folks with via this genetic testing, that's going to help fuel those results. So I really appreciate you saying that. And I also appreciate you looping in those other caregivers because, yes, it is very easy to think of genetic conditions as being, onset in a pediatric state. But obviously, these can have lifelong implications, and some are not going to be diagnosed until much later in life, or to your point, we're talking about Alzheimer's, etc. So I really appreciate you calling that out.
Mm-hmm.
um, you also mentioned in some of the work that you guys do in providing free genetic
Yeah.
testing. Talk a little bit about the financial barriers that can come with genetic testing.
Yeah, there are several. I think there's some that are obvious and some that are less obvious.
Yeah.
I think the obvious one is these tests are really expensive, and even if you get, even if you're lucky enough to be in an insurance plan that covers a portion of the cost, your out of pocket could still be hundreds of dollars. So it's prohibitively expensive, especially for families that are already burdened by medical bills. That's the obvious one. The genetic test costs money. The second one is the physician meeting that you have to go to get the genetic test. That might be a neurologist, right? And they're really expensive specialists. That's also expensive, and we also cover all of that. And then I think the hidden cost that's less obvious is if you're a caretaker, you might not just have one person you're taking care of, but you might have other responsibilities. You might have a job. And so for you to go to that physician meeting takes travel time. You might have to take time off work, all of that. And we try to remove literally every single one of these financial barriers by making sure that you don't get billed for a test. We never even collect your insurance information, and no credit card. We have no way of billing you. You don't have to pay for any healthcare services because we cover all of that. And you don't have to go anywhere because we just ship the kit to your house. And it's got a prepaid return label on the back. So you literally have to do nothing aside from collect the sample and put it back in the mail. Yeah.
Wow. So I think you hit on kind of multiple barriers there and how you're addressing a lot of them all at once in terms of both the financial piece, making it more accessible, but also it just showing up at your door really eliminating some of those hardships that caregivers will encounter when making sure that their loved one is accessing some of these tools along
Yeah.
kind of their healthcare journey. So um, I also, I definitely want to hit on, the work that we've been doing together in collaboration, because to speak to some of these barriers, and there's certainly a number of other barriers. We talked a little bit about like the knowledge piece,
Yeah.
that being really difficult because oftentimes you don't know that these things are out there,
Yes.
and to ask for them or to ask, okay, well, if this is a path to getting that diagnosis, what's our next step? So what are ways that people can facilitate some of those informational gaps? What are some access to resources
Yeah.
that individuals may have more readily available?
So I think the single most important thing that we do is everybody who gets tested gets a session with a genetic counselor at the end of the process. And genetic counselors are extremely trained, highly dedicated people that went to grad school to learn about genetics and how to explain the results to patients and to caretakers. And so everybody who completes testing at some point gets a link where they can book a video consultation or phone consultation with a professional who can explain to them what the hell does all of this mean
Right.
and what am I doing next. I think that's the single most important piece, and the telemedicine genetic counselors we work with are fantastic. Beyond that, we try to do an increasingly good job at putting a lot of information on our website so that you can learn more about how the process works. We also have a fantastic customer support team that you can call at any point and that you can email or hit up on all the socials, and they'll respond to you super quickly so that any questions that might come up can get answered quickly. And then maybe one piece that's underappreciated is the importance of patient advocacy groups in this entire piece. So CAN is obviously an advocacy group that supports across many different diseases and supports the caregivers, but there's a plethora of advocacy groups that are disease specific. And so once my loved one has this one specific immunodeficiency, then we try to connect you to the very dedicated individuals at those advocacy groups so that they can connect you to additional resources, because they're in with the drug developers that might have treatments available or that might have trials available, and they are in with patient support teams that can provide very dedicated support for your specific disease of concern.
Fantastic. Yes, I think connecting to those patient advocacy groups is so imperative because that is an additional resource that provides levels of different kind of connections, be it, these bits of information on clinical trials, which we'll be talking about in our next Real Talk. We're trying to keep it all on theme. But also things like support group and some additional information that may be disease or condition specific, especially if you're new to this
Yeah.
diagnosis. That can be really, really important because you may have just heard about this condition for the
Yeah.
first time along with your loved one, and now you have to figure out what are we doing.
Yeah.
So I really love how it's just a really multifaceted, let's make sure that the information is understood by both the individual and the caregiver, but then let's make sure that they're getting support as the journey continues. I think that's phenomenal. So, um, we've given all this wonderful information about how fantastic genetic testing can be, especially if you're on that diagnosis journey. And let's talk a little bit about our partnership to make that more accessible to folks who
Yeah.
may be listening right now.
Do you want me to describe at a high level how it works,
Yeah.
or? Um, yeah, so we've been really lucky to be able to partner with your organization, where CAN applied for a grant that was given out by the Alexion Foundation, and the Alexion Foundation is supporting this entire program, which means that we can expand the offering of completely free services to people in the CAN network. And the way that it works is pretty simple. You can either go to the CAN website. I think on your website you've got a link embedded. Yep. That people can directly complete the intake and then become part of the program and get free testing. Or alternatively, patients can also go to our website and type in probablygenetic.com and then get access to free testing in that way. Aside from the fact that we can provide free testing to folks who might be in need, we're also hoping that this advances rare disease research overall, because everybody who comes out at the other end can then be linked to the advocacy groups you mentioned, and not to take away the thunder of your next talk, potentially participate in clinical trials. And what's also really important is by contributing the data on people who participate in this to research, that helps other patients as well, because more people can get diagnosed, and hopefully at some point we can make a real dent in that only 5% of rare diseases that currently have a treatment, to hopefully get that to everybody.
Yes, absolutely. And I think I may have shared here in the group in previous Real Talks, but as someone with a rare disease, I was diagnosed very early on, but I've recently gone through the whole genetic testing piece because of health issues that were present in other family members, and I was starting to have some complications as well.
Yeah.
And so after dealing with some symptoms for quite some time, it was very powerful to have answers. And, it can be scary to go through the process for sure. But, as I said earlier, knowledge is power. And I think that having that knowledge is so empowering in terms of, taking those next steps with your loved one to make sure that, they're getting the care that they need, and, that those questions are being answered. So I want to thank you so, so much for taking the time to chat with us. I'll be putting a link to our website that has some information about our partnership with Probably Genetic, as well as links to find out more about how you can get started on your genetic testing journey. But as always, if you are someone who has also gone through an experience where your loved one or even you have had genetic testing, share. We always want this to be an invitation for folks to share their experiences, because we want to hear from folks that have been where we are. So please sound off, and if you have any questions, always feel free to reach out in the comments and let us know. But thank you so much, Lucas. I really appreciate your time.
Yeah. And thank you so much for all the amazing work you do and for inviting me on this conversation. I really appreciate it. Thank you, Nicole.
Yeah, no problem. All right, everyone. I'll see you in the group.
Bye.